your body came from the earth. It's created from the earth, from earth materials, and it will go back to the earth. And so why not establish a system of medicine that is based in the earth? I practice systems biology, right? That's what I do. And so I look at the system and to see if there's a disruption in that system. So if there's a disruption in the system, it needs to be corrected. So when somebody comes into me, I'll look at, okay, what are your deficiencies or what are your symptoms? How do those relate to actual biology or systems biology in the earth around us? And then how can I create or establish a pattern of dysfunction that makes sense based on your symptomology? It's super important for us to be able to have a variety of different ways of looking at the body. We want to, when we approach your care, we want to see what the causative factors are. Not just, okay, let's see if we can cover up your symptoms or ameliorate what it is you're dealing with right now. Are you tired, bloated, overwhelmed, fatigued, been to multiple doctors and been told there's nothing wrong with you?
Your blood work looks normal?
Yeah. Well, we have an answer for you today, and it's very likely to be found in functional medicine.
You're Dr. Ron Dummar. I'm part of the podcast. I'm a friend and patient here at the Community Health and Wellness Clinic in Heber City, Utah, and you are a functional medicine doctor. The Be Well Now podcast has been going on for more than 100 episodes. We've covered a lot of issues, a lot of topics, blood work, acupuncture, creatine.
The list goes on and on, for sure. Cupping, gua sha, all those techniques.
We talked about peptides recently. The reality is there's a lot to talk about, but you know a lot. And I asked you, let's talk about something that your patients bring to you a lot. Some of these issues that they're having, right? They've gone to other doctors and they just feel like, is this my life? Like, I don't feel great and I don't really have a lot of hope that I'm going to feel better because I've tried a lot of other things.
Yeah, and it's really interesting because, like we said, with the labs, especially when you look at the labs, they're being told that everything's fine. And this has to do with a very specific, unique difference between looking at the body in a functional manner or in a systems biological manner, right? I practice systems biology. Right? That's what I do. And so I look at the system and to see if there's a disruption in that system. So if there's a disruption in the system, it needs to be corrected. From a Chinese medicine perspective, this is actually super interesting because if you look at the world around you, a lot of Chinese medicine was based around or patterned around the world and the environment around us. So if you look at fire can consume wood, right? And wood burns and creates ash. Ash compresses and creates metal. Metal can, if you go into like a cave where a lot of metallic substances are, you often see little seeping drips of water. So formation of water comes from that. And then also we see from water is generated wood, and then wood burns, leading to fire.
And how does that relate to the human?
This is, yeah, exactly. That's a really good point.
Because I still never get that when you bring up the nature and then us and Chinese medicine.
It's so perfect.
I trust your expertise because I know you've been doing this for, how long have you been?
We've been doing it for about 17 years. Okay. Now, here's the interesting thing is that your body came from the earth. It's created from the earth, from earth materials, and it will go back to the earth. And so why not establish a system of medicine that is based in the earth? Because you literally are of the earth. So if you're not using a system of medicine that is earth-based, then you're way off mark. Okay, so if you're creating synthetics, if you're creating petrochemicals that have no real connection to nature and they're unique compounds that don't exist in nature and can't be replicated naturally in nature, then you are not dealing with natural compounds. You're not dealing with earth-based medicine. So earth-based medicine is critical. If you're going to a functional medicine doctor, you want to make sure that they practice in a systems biological or earth-based medicine approach. So in Chinese medicine, the fire relates to the heart. That kind of makes sense. There's a lot of activity that happens there. It pushes a lot of activity, pushes the blood through the body, right? And essentially creates a lot of opportunity for us to receive nutrition and nutrients. Okay, fire itself generates earth or the spleen. So it helps with digestion and it helps with that's what the spleen and the pancreas and the stomach do. That's related to the ash. Okay. So spleen, pancreas, and stomach are related to that. And then that generates ultimately the metals, right? And metals are related to the lung. And so we're looking at how these organs actually support each other. So when somebody comes into me, I'll look at, okay, what are your deficiencies or what are your symptoms? How do those relate to actual biology or systems biology in the earth around us? And then how can I create or establish a pattern of dysfunction that makes sense based on your symptomology?
Can you give me an example? Because this sounds very ethereal. And I'm like, just give me a real example where someone wasn't getting what they needed from the standard medicine model. Their blood work looked quote unquote normal. They come into you and you apply this and it works, because that sounds kind of out there to me.
Yeah, for sure. So I'll give you a really good classic example. A lot of people that you know who drink or go to alcohol often have what condition?
Fatty liver disease.
Fatty liver disease. Okay. What other conditions? Let's look at more of an emotional standpoint. So let's say what emotions might be tied. So liver actually has emotions tied to it. Okay. And the emotions that are tied to the liver are anger, irritability, anxiety, and depression. Okay. So now tell me, have you ever seen or experienced somebody who uses alcohol, which causes issues with the liver, express in an anger, emotional, anxiety, or depressive type way?
Sure.
It's very common.
Right.
It's very, very common. Okay, well, here's another thing is that there's a pattern in Chinese medicine where when the liver itself is not being supported properly, it will overact. It's a pattern that we see very frequently. It overacts on the spleen and stomach, so this is digestion. Right? So if you've ever been nervous or irritable or felt like angry sometimes, and then you have stomach related issues or digestion related issues. So stress and worry. Have you ever heard the term, stop stressing me out, you're going to cause me an ulcer?
It sounds very like 80s, but yeah, I've heard it.
Yeah, but that pattern within our society is it's pointing to something of truth, right?
Okay.
Because that's what we experience. So the liver actually does overact. Stress, anxiety, those type of conditions can lead to a dysfunction or an ulceration within the stomach. It also can lead to acid regurg or regurg from the stomach into the throat when you get that burning acid into your throat. So what we will do ultimately with those patients is we'll use a variety of techniques. We can use herbals depending on their age as well. We can use herbals. We'll use acupuncture. We also want to first determine what is it really coming from. Is it actually a dysfunction in an imbalance in the liver, or is it coming from the stomach itself, right?
And you can find this through labs, and then you analyze the labs?
We do that through labs, and also there are some other tests that you do, like different baking soda tests and other practical things that you have patients measure and report to you as well. So we have them do those things.
What's a baking soda test?
So you consume baking soda, and you count essentially the amount of time that it takes. If you start burping or belching, right, and you let us know, okay, how quickly did you start? Well, if you consume baking soda, have you ever done or seen those experiments in third grade?
Yeah.
Third grade, where you put like a bunch of baking soda in your volcano and then you pour vinegar in it. So you're adding acid to a base, or vice versa. You have a bunch of vinegar and you add the base in, right? So if we add a bunch of base and your stomach is acidic, what should we have happen? It should release gas. You should have burping.
So these are clues for you to keep helping to
So if you don't have burping, or if it takes a long time, right, and you're like, well, I'm not really sure, or you're unaware of whether you're having burping, then the reality is it's very likely you have low stomach acid, and it's more of a stomach issue maybe, or maybe there's some liver and stomach spleen issues going on. So that, yes, it is very deep, and it is very, you could say, complicated on some level, but the simplicity of nature, you look at the patterns that we see in nature and how they interact with each other, and that gives us the clues to say, where do we want to begin to treat?
Well, I was asking you for a specific example, and I think we kind of went off the deep end. It was great analysis and detail, but what did you treat? How did you do it? What did they get from another model? And then what how did your method work?
Yeah. So acupuncture, for instance, you put a patient under acupuncture, they have anxiety. Anxiety is causing, we've determined that the anxiety is actually causing the disruption in the stomach that's causing the regurg, the heartburn for the patient. They're getting all this heartburn. Great. So we do acupuncture. We usually will have them do a round of 3 to 4 treatments.
Is it just a community acupuncture in this room?
They can do it. And that treatment is not necessary. I mean, obviously you need the evaluation, right, to determine what is really happening. But once that's taken place, then they can do community acupuncture.
It's just an example of a way that it's not like every little thing is going to cost $1 million. Community acupuncture, which I love. Yeah, you fill up the room here and it's like $35 and it's great. You fill out a form. It's very tailored and everyone's kind of quiet and does their thing and everyone just like blisses out or whatever they do, falls asleep. I don't know. Acupuncture is usually very enjoyable. So that's one modality you use to help them.
To help that in that instance. And there's a number of other instances as well. I think one of the ways we started this podcast out as well is saying, you go to your doctor, you're tired, you're fatigued, you're worn out, you're bloated, right? You have all these symptoms. And so what we'll do frequently with these individuals, they say, we've been to everywhere. We've been everywhere. We've been to this doctor. We've even been to naturopaths. We've been to, nurse practitioners. We've been to RPA. We've been to all sorts of doctors. We're being told that either they don't have any more that they can do with us or that they think that we're fine and that it's in our head. And that is a difficult state for them to get to because they feel intuitively and innately like there is something wrong. There's something that is just not right yet. And if anyone's ever been in that position, if you ever feel like, man, I'm just not 100%. I'm just not quite there. Well, you recognize what these people are going through because you do recognize, regardless of whatever anybody says, regardless of what your labs say, you feel there's something off. And so that needs to be acknowledged. And that's the beauty of, and the reason I was telling you about the cycle of biological or systems biology in Chinese medicine is because it allows us to pick up on the very, very nuances, the basic nuances that you may not even see in a lab. Sometimes even a functional medicine doctor may not see that discrepancy in a lab, but Chinese medicine will pick up on it because of the patterns that we see. Okay, so that is critical. It's super important for us to be able to have a variety of different ways of looking at the body. Okay, that's probably one key indicator I would say if you're looking for a functional medicine practitioner as well. They can't just have a standard approach, the standard medical approach to care. It's got to be root focused. They've got to look either upstream or downstream, right? And at least have this understanding of saying, look, we want to, when we approach your care, we want to see what the causative factors are. Not just, okay, let's see if we can cover up your symptoms or ameliorate what it is you're dealing with right now.
Yeah, I had a recent thing where I went to an ENT and it felt like I was going through like this big machine and got a CAT scan and then was told I had these severe allergies and just like, here's like 4 pharmaceutical drugs we want you to try. And I was like, allergies seem like they'd be much more complicated than that. And I looked it up on ChatGPT, from a functional medicine's perspective, like what are allergies? And it was like, there's a lot going on with your GI tract and everything. I was like, he was just trying, and I'm not disrespecting him. I'm not going to label or name him, but it was like, he was trying to ameliorate the symptoms and I'm trying to figure out what is causing the symptoms. Yeah. Because I'd like to address that if I'm going to be on this earth for a while.
Yeah,
I want to figure this out. And I still don't really know yet. Mm-hmm. I need to talk to you about that. But it was obviously he's just trying to help me out in the best way he's trained. But I was like, I don't play like that. I'm looking for the root cause. How can we address that?
Well, and those, to be fair too, those are good things to go through. Information is good. It's important. And to get people's evaluation of the situation is important as well. Sometimes it does add
I'm glad I did it.
Yeah.
I got the CAT scan, everything, sinuses look good. So I was like, okay, I did the thing.
Yeah. And you're like, hey, I actually feel good. I feel good about this. Right. And you're generally given a series of options of care. And then oftentimes people are like, well, I don't, it was steroids or I needed to do an antibiotic, or I needed to do a variety of different things. And I just wasn't sure I wanted to do those, right? And that's when often they'll come to me as well. It's like, okay, well, if you're looking at a situation where maybe you went the medical route because you wanted to see what, all their fancy tests or diagnostic equipment, and you're like, okay, they've got all this, I just want to see it. And you get your diagnosis, you get the evaluation and the information. Now you're in the driver's seat. Now you can say, what do I want to do with this, right? And if you take a functional medicine approach, ultimately you're going to say, okay, now let's look at that and start thinking again, where does that come from? What is it that generates one of the largest amount of our immune responses in the body? It's generated largely in the gut, in the GI, right? And then what about lymphatics and lymphatic massage and the movement of the lymphatic system, because it's got to transfer all of that inflammatory chemical that's elicited by the immune response, and it's got to be able to help the body evacuate it. And so our lymphatics are so critical and important in that as well. So you have to account for a number of different aspects of physiology in any condition that you're addressing.
Well, I wanted to kind of bring it to, if you're out there looking for a functional medicine doctor, what might someone look for in a doctor? What would be some red flags? The reason I bring that up is because you have a fantastic lymphatic massage.
Brilliant.
She's like, I think she's actually like channeling like some God-given, like just magic.
She's very talented.
Like, amazing.
Gifted. Mm-hmm.
Gifted, right? And I think that would also speak to you for like, having that person on your team, as a part of the team. So it's like, I think you are a very busy, clinic, community health and wellness in Heber City, Utah, for a reason. But yeah, what might people look for if they're not here locally? What would be a red flag? Like, I live in Atlanta, Georgia. I'm looking for a functional medicine doctor. What should I be looking for?
Well, I think one thing that's important is to check credentialing. Like, you want to make sure that they are actually have some sort of trained medical credentialing. Typically, you want to look for an NP, a DC, a naturopath, a DABC, DABCI. Okay. It's an internist. So there's a variety. Obviously, there are medical doctors that do and choose to be functional medicine doctors. God bless them. And there are osteopaths, DO. Those are all very well credentialed. They have a sound understanding. We know that the training and the background, even in Western medicine, physiology, biochemistry is very sound, and it's standardized across the board. So it's essentially going to be really similar for all of those. Okay, so that's one recommendation that I would make. There's a lot of people that are saying they're functional this, functional that, or a functional nutritionist, or a functional, and they just throw the term out there because it's become so popular and a catchphrase to get people's attention. Well, you have to look deeper and really, I would say, ask them, okay, what's your background? How long you've been practicing? Right? How long have you been practicing functional medicine? Right? Have you always been practicing functional medicine? Or, sometimes they have they're seeing a niche in the market, and then they want to jump into this. There's also, I would say, there's these clinics that call themselves functional medicine clinics. I don't know that I would say that it's all the way there, but they have a few things that are pretty cool for like just general health, maybe like a sauna or a cold plunge, and then they have patients do a prescription or a subscription, to that. So they pay for a subscription to that, and then they basically use the general practice doctor or whoever it is as their GP. And I don't know that I really consider that functional medicine, because when that doctor's looking at my labs, is he really looking functionally, or is he really just still looking traditional medical?
Well, what is functional medicine versus traditional medicine?
Yeah, well, that's a good point. So one of the things that we're able to do...
Chinese medicine earlier, I'm like, I don't think all functional medicine doctors are trained in Chinese medicine.
No, but that's one thing that I would call a big plus, because it gives you, it gives you a huge introduction or huge leg up into what it means to practice systems biology, to what it means to really go upstream, to have a method of evaluating a patient and critically thinking through a process of what it is that might be really bothering that patient, truly underneath the symptomology, right? So that's why I went through that process at the beginning. And yeah, it may have been for some people like, wait, where are we going? But at the same time, it's critically important, and it gives us, I feel like it gives me a huge leg up, because I'm able to evaluate people on a much higher level or a much deeper level that way. So functional medicine from a lab standpoint, let's look at it this way. Functional medicine practitioners, I would say, what is their go-to? Do they call themselves a functional medicine practitioner, but you keep getting prescribed medication? Is that the first go-to? If that's the first go-to, in my opinion, it's unlikely that you're getting a true functional medicine practitioner. Okay. Now, are medications going to need to be utilized sometimes? Yeah. It's an integrated approach. So that's integration. So sure, you could say they might be trying to integrate, but are they functional? Well, I don't know. A root cause, what's causative in the disease process is really what they need to be looking at. The next thing is, again, those labs, because we as functional medicine practitioners and Chinese medicine, even in nutrition, we use the tools that we use to heal they're safe. They're food, they're herbs, they're plants, they're compounds that exist in nature that are from the earth. That's where your body came from, and that's where it's going to go back to. And literally at some point, you will have completely amorphosized, become the earth again, right? At some point, you will have become completely the earth again, contribute back to that. So just that symbiosis that you have with those elements is critical to understanding, okay, now let's take medicine and pull it from the earth. Let's take medicine and pull it from the earth. So the food, does it grow? Can we pick it? Does it have a life cycle, right? That's what we're looking for, those things. But we use those foods. That's the point. We use those foods as medicine. So as a result, when you go into the doctor's office, these labs are slapped down. They say, look, I don't see anything off. Nothing really is irregular here, so you're fine. Okay, well, that's because they're dealing with a reference interval that is about this wide. Okay, you come into my practice, and because I'm going to prescribe you food and maybe supplements or nutrients and things that are going to be really beneficial and nourishing for your body, I take that window and I bring it into more of an optimized or an optimal window. Okay, so I'm looking for true health, not just, okay, how do I prevent somebody from being catastrophically ill? That's what this wide interval is all about. But I want to know, am I going to be prescribing something for a patient? Is it going to be beneficial for their ultimate health overall, their optimal health? And so I bring that window in. That on some level you could say is a functional medicine practitioner, because now I'm narrowing the scope of health. I'm optimizing the patient. I'm saying, okay, I want you in all these values to be optimal. And those that are not optimal, we need to be looking at why. Okay, so if the kidney is dysfunctional, if there's a dysfunction in the kidney, if there's a dysfunction in the liver, I'll look at that and I'll say, okay, blood urea nitrogen. If there's a dysfunction there, or creatinine, right? Those are values that you could look at for kidney health. And blood urea nitrogen is the one that's interesting. It's often equated to kidney health, but the reality is it can frequently be equated to liver health, because urea itself is actually created in the liver. It's secreted by the liver into the intestines. It's taken back up and secreted by the kidney. Okay, so a disruption in the secretion of that blood urea nitrogen, or a disruption in your blood, can indicate to us either a liver condition or it can be a kidney condition. Okay?
And what's a Western medicine, model going to do for that kind of condition?
Yeah, well, when you look at that, generally they will do nothing for it. They're not going to do anything generally for that, because those are conditions oftentimes that it takes more of a narrow view to even find. Like when you're looking for optimal health, you say, okay, you're outside of an ideal reference interval, but you're actually not outside of the traditional or the medical reference interval. So to them, you look perfect. But when you go to optimal values or optimal levels, you have to realize that the majority of the population in the United States is actually chronically ill. And so we're using these reference intervals as a status of health information, and they've allowed us to basically generate chronically ill patients across the board in the United States, right? So what we do in functional medicine is we scale that in and we say, okay, we're going to use a more narrow optimal window, and then we're going to assess this. Okay, this value might be high, and that relates to this value over here, which may be low, right? Also, for me, ratios. I love ratios. They're really, really important. For instance, the amount of
sounds super interesting to me.
Yeah, they're so critical.
They are important
in your values, right? So if you look at your lipids, for instance, what a lot of people don't realize is that cholesterol is a healing tissue. It's a healing tissue. We look at it as a bad thing. Cholesterol is often given a bad name, right? Because we equate it with heart disease. We equate it with cardiovascular disease. And the reality is it is a tissue that is designed to heal the body, to heal the cardiovascular system, and to heal the brain. Okay? So when we look at this and your lipid panel and we see that your cholesterol is slightly elevated, then we need to be thinking, okay, the cholesterol is slightly elevated. This means that there may be signs of inflammation in the cardiovascular system or in the nerves, because the body is receiving a signal that says, hey, produce more cholesterol. Okay, now I need to know also, are the triglycerides elevated as well? If the triglycerides are elevated, then we may be looking at, and especially if they're elevated quite high, even close to the total cholesterol, we could be looking at a blood sugar regulation issue or even a pancreas issue, right? Could be like insulin resistance. However, if your triglycerides and your total cholesterol are within a 2-to-1, like you want twice as many cholesterol as you do triglycerides, a 2-to-1 or a 3-to-1 ratio, I look at that and I say, that's perfect. Even if your total cholesterol is higher, even if it's higher than we would expect it to be, I look at that and I say, well, that's actually really well balanced. Then we got to look at the HDL and the LDL. So there's other ratios in there that we can look at and say, okay, it's bigger than just saying, are all your values within a specific interval or range? No, we want to know what the ratios of them are and how they interrelate to each other. Are they elevated? Are they depressed? And how can we, from a food standpoint, increase or improve that?
When you have a litany of herbs back here that you have curated, and you've got these medicines back here, and then also a bunch of supplements from high name, high reputation companies. So it's like earlier you mentioned, well, they're just going to hand you a medication. You also have your own medicine, but it's different, right?
Yeah. So we do make formulas. So I make our own formulas here. I have a pharmacy of over 300 individual single herbal extracts. And I put those together based on patient presenting complaints. And over the years, I have some that I really like and we've used repeatedly and they work really well. One of those, for instance, is itchy eyes. We also call it Neuroprotect. We use it a lot for allergies. Hay fever, things like that, seasonal allergies. It works really, really well. The kinds of allergies where you have histamine reactions in the eyes, the nose, and the face, right? So those allergy reactions, it performs really well with. Okay, we have a whole host of formulas that we write. We do also have supplements. Like when we're talking about prescribing things for patients, just handing them a medication. We do have supplements, but we're looking at your blood. We're looking at the what we've evaluated and what the dysfunctional pattern might be. Okay, so is this a deficiency of liver? Is it a deficiency of an actual nutrient or vitamin, or is it an excess, like an infection of some sort? And so if we're looking at an excess, then we need to calm that excess down. If we're looking at a deficiency, then we need to build that and nourish that up, right? So it's all about, are we supporting it or are we sedating it? So are we nourishing or are we sedating? And sometimes people will look at a pattern, they'll be like, oh, we should actually sedate this. And the people are already emaciated, they're fatigued, and they're trying to sedate in a situation where the body is already overtaxed and over fatigued. And they're throwing like parasite cleanses and viral cleanses. They're trying to do all of these detoxification things. They look at things online, and these patterns that they look at are just causing more and more deficiency. Okay, and what they need on some level is to be nourished, to be built back up. And if you're in a state where you feel tired, you feel fatigued, you feel bloated, this very well may be you. It might be that you're the one who's had all these things thrown at them, and you've done research on research, and all you keep doing is detoxifying, trying to cleanse, trying to empty, and it's so downward draining, and it's so heavy and so fatiguing that you feel overwhelmed by life, because that's how it is. And what we need to do when we bring them in, I look at them and I say, look, first thing I need to do is actually build you back up. We've got to get you back up and put together again, and then we can start addressing if there's anything that we actually need to be detoxifying or cleansing or doing some sort of viral or parasite protocol with. But we have got to be in a state where we can support the treatment. We have to be able to take the treatment and receive the treatment. And if we're not in a state to receive the treatment, then no type of treatment is going to be beneficial for us.
So what else do you have in your office that helps, heal patients upstream, downstream, like functional medicine doctor? I'm looking for, examples of what you have in terms of what I might look for.
We love to do, one thing that we are doing a lot of is ozone injections. We like to do those in place of cortisone and corticosteroid injections.
So I've done ozone nasally, but what do you mean injection? Endonasal. Yeah. I'll breathe it in, and that helps the lungs a lot. What
you're talking about the breathing treatment, ozone breathing treatment.
Yeah. What is injecting ozone?
So when we inject ozone, we do that to help patients with tendon, ligament injury, inflammatory related conditions, tendonitis, bursitis.
Would you do that before peptides?
I would definitely do that.
All right, we need to talk then.
Yeah. So what we do is we inject some nutrients. Homeopathic nutrients is usually what we inject. And then we'll follow that. We'll chase it with the ozone. And the ozone is 3 oxygen molecules bound together. So we're going to hyperoxygenate the area. It's also a redox reaction. So on some level, it is going to cause or elicit free radical damage, you could say. You're like, well, wait, what would I want free radical damage? Every time you work out, you're actually eliciting free radical damage. Okay, you're promoting this process of degradation in the body that clears the debris. That's what you're doing when you work out. You're clearing the debris, the built up tissue, ultimately. So you can get to a place where you can clear that. Well, sometimes we have joints, we have tendons, they're not very well vascularized. It's just a state of inflammation, and we've created tendonitis over a period of time, or tendinosis. And the issue ultimately is really difficult to address. So we will go in there sometimes with gua sha, with a scraping. We'll do tissue work on that. We'll do all sorts. We'll do acupuncture, dry needling. We'll do the e-stim through the needles and everything as well. And it's just not quite getting it. And so then what we do is we say, okay, well, let's throw this at it. We'll put some nutrients in there. We'll get the ozone. And the ozone essentially kind of agitates the area, like wakes it up, and draws the attention of the body to it, improves the circulation, the blood flow. You're going to have a dissociation take place. So the ozone, the bond, 3 oxygen molecules, is an unstable bond. So it's not going to stay or stick around for a long period of time. It's going to release that oxygen molecule, and then you're going to have oxygen, and you're going to have a free radical. So then your body has to deal with, okay, this free radical, and then the immune system comes into the area. It begins the process of healing and tissue repair very quickly. So that's why we use ozone. We do a whole host of other things. We do have, we treat all through pregnancy as well. We treat patients in pregnancy. We treat infants also. We do functional pediatric care, you could say, or holistic pediatric care. We have help patients, mothers navigate earaches, toothaches. We help them navigate rashes, all sorts of immunology related issues as well. And so, yeah, there's a whole host of things that we treat here. One other thing that I would like to say is actually about our brain program here. So we do a lot with brain injury traumatology. That was one of the postdoctoral certifications that I received as well, was in brain injury traumatology. And it's always been, for me, something that I felt was very, very important, that we have to have the brain working properly. And one of the things that we've done is we've put together this system ultimately that allows us to use the movements of the eye, and to use that and combined with the balance, how stable a person feels. We have a board that they stand on, and then we measure their eye movements, like with this virtual reality headset, and that all gets fed in to a computer, and we have these algorithms that we put together that will give us exercises ultimately that they can do based on to the specific faults that they have. And so brain is super important. Everybody knows brain health is so critical in life. And we all want to be a little sharper, a little bit clearer, right? And preserve our mental health for the rest of our life. And this is one way, one opportunity in a functional medicine approach to saying, what is it that I can do to maybe reduce my migraines, reduce my onset of headaches, reduce my neck pain. We've had patients that have had improvements in thyroid function after they've had their brain exercises.
Wow. It's all connected.
Yeah, it is all connected. It's systems biology for sure.
Dr. Ron Dummar, Community Health and Wellness, the Be Well Now podcast. I hope folks are finding value in this, and if they do, that they subscribe to the channel. Any final thoughts you wanted to add about, what functional medicine is and what you offer here, and just someone sitting out there, they're one of your patients, or an avatar of one of your patients who comes in, and you can tell they're suffering, and they just feel like they have the weight of the world on their shoulders, and they just don't feel like they're getting the answers, and they're starting to lose a little bit of hope.
I had a patient come in recently, and I take the work that I do really seriously, and it is a physical work, but it's also an emotional work, and it's a spiritual work. And part of the spirituality that I take seriously is I do pray over this space, and I pray for all my patients, and I pray for their well-being and for their success. One of the things that I do, and it might be considered kind of funny, but I've always blessed this space. I bless it regularly. And one of the things that I that I do in the blessing is I'll ask for even the walls to be filled with healing angels. And I always thought that was interesting, but I always felt like, I'll just continue saying it when I pray over the space and when I bless it. And the other day, a patient was saying to me she was moving, and it was really sweet. It was very, very touching. But she said to me, "Oh my God, I don't even know what I'm going to do. What am I going to do without this place?" She said, "Even just sitting in the front room, sitting in the waiting area, I feel just an immense peace. I feel like my healing begins when I walk through that door." From the staff are so incredible, and they're so interested in helping you become better or become well, right? To get well. And ultimately, she then said, and this is the part that caught me, is she said, "My goodness, just even the walls of this place." She literally said that, and I couldn't believe it. And it was like a message to me, of like, hey, even the walls are providing a healing space. And this is I would like to say on some level, this is certainly a space dedicated to healing. We take it seriously. We honor that. We cherish the opportunities that you provide to us as patients, to be agents in your journey, in your health journey. And we wish the best for you.
And if they want to reach out, how can they do that?
If you want to reach out to us at Community Health and Wellness, you can find us online at chwheber.com, or you can call our phone number 435-657-3696. Or you can connect with me on Instagram, Dr. Ron Dummar. It's Dr. Ron Dummar.
And also the Be Well Now podcast has a Instagram page, so they can do that as well.
And leave a comment. Like and subscribe.
We're getting traction, but we want to see more comments out there.
Yeah.
As we end the podcast with our favorite song. The Be Well Now podcast, presented by Community Health and Wellness. Be well now, everybody.
Be well now. Namaste.
Namaste.